Health Department says it's concerned about remarks made by the Gender Commission on mandatory vaccination and women's health. Earlier this month, the Commission released a statement saying it was worried about the effects that COVID-19 vaccines may have on women's health. It called for mandatory vaccination not to be imposed. In particular, it made certain comments about menstrual cycles. We're joined now by the Deputy Minister of Health, Dr Sibongiseni Dhlomo. Deputy Minister, good afternoon to you. Thank you for your time. What are you as the Health Department worried about here? What do you believe that the Gender Commission has got wrong?
We look at the statement of the Commission of Gender Equality. It's a great but we don't think that they have a mandate in that.
Deputy Minister, I don't know if you've muted us perhaps. I don't know if we were able to just hear you clearly. It seems that there is something wrong with that sound there. Deputy Minister, I was asking if you have unmuted yourself, sir. What do you believe the Gender Commission may have done wrong here?
Are you able to hear me?
Yes, much clearer. Thank you, sir.
Yeah, we look at the statements of the Commission for Gender Equality. Great disappointment. Firstly, we don't think that they have a capacity and mandate to issue such a statement without consultation with those in the country who are mandated to deal with these issues on a daily basis. I'm sure if they had phoned the minister and given the minister their scientific opinion, the minister, given his background, would have advised them. But I think the minister also would have cautioned to say, look, I'll consult my experts, the DG, the medical team, including the Ministerial Advisory Committee on this matter. COVID-19, Stephen, is relatively a new pandemic, and most of the things that we see here are still relatively very new. So the best ever information that you can give to someone who's saying, what is your view on COVID-19 and menstrual cycle, is that I don't know. So now we think them issuing such a statement is almost bordering on irresponsibility. The MEC, Ministerial Advisory Committee, advises us on the benefits and the harm or side effects of vaccinations. And we think maybe let's follow that line. As directed by the minister, we are consulting with the Commission for Gender Equality because we want to have a meeting with them tomorrow on this matter. So they have not replied to our wish. It was all evidence that we have actually cannot support their statement that released. We have even been following this matter up with the Medical Research Council, and the advice that we get, in fact, is the opposite of what they are saying. The advisor from the Medical Research Council is that vaccines are highly effective against severe illnesses. Immunizing or vaccinating women of a reproductive age is quite important, and that data is available both from South Africa and the global information. That COVID-19 infections in pregnancy significantly worsens the obstetric and neonatal outcomes. Now, this also is supported by the team of doctors in the country under SAMA and the Society of Obstetricians and Gynecologists. So we don't know why they would not have consulted science in terms of making the statement. So we think the statement needs to be corrected, and therefore we are actually arranging. We hope that they will allow us to meet with them tomorrow and clarify this statement.
Are you saying, sir, that in your view as the Health Department, do you believe the Gender Commission did not base its comments on science?
Absolutely. Because now maybe I could have said differently if I was there. That's why I'm saying the minister would have cautioned them, but would have consulted. After extensive consultation from people who actually, in the country, you can't have a better organization than the Society of Obstetricians and Gynecologists to consult on this matter. We actually have received also scientific evidence from Medical Research Council. Now, what more would we want in the country to come? If you can have any view that actually would oppose that, then we'll welcome it. But these scientific institutions have advised us that, in fact, this is very irresponsible to issue a statement like that, and they would wonder what information, which scientists would have backed them up to say what they said.
Deputy Minister, thank you very much indeed. Dr Sibongiseni Dhlomo with us on The Pulse tonight.